Hello, thank you for joining us today for a local snapshot of the COVID-19 situation in the Southwestern Public Health region to understand what data helps drive our local response. Crystal and I are members of the epidemiology team at Southwestern Public Health. We will walk you through important local data that we use to determine the risk of COVID-19 in our community. This local data is presented to Dr. Locke and the Emergency Control Group to inform their decisions for lowering local risk in our region. Some measures are determined by the province, but we also have the ability to implement additional measures. For example, a face coverings mandate was implemented in the Southwestern Public Health region in July 2020 as a measure to reduce the spread of COVID-19. The provincial face coverings mandate was not implemented until fall 2020. A Section 22 self-isolation order was implemented in the Southwestern Public Health region in July 2020 as a measure to reduce the likelihood of individuals transmitting the virus after testing positive, which was a growing trend at that time. We also share local data daily through our dashboard to keep our community aware of the local risks so that they may make decisions to protect themselves. This information can also be used by healthcare partners. For example, by helping healthcare partners prepare for potential surges in hospitalizations. We use several different measures to determine the level of risk. Thresholds for different risk levels, i.e. very low, low, medium, or high, are closely aligned with the provincial framework wherever possible. For example, a weekly incidence rate of 40 cases per 100,000 or higher, which equals 85 new cases or more reported to us in 1 week, places Southwestern Public Health in the red or high-risk zone. Notably, the province also includes a gray lockdown zone, but that level did not list specific indicators or case thresholds. Instead, the province's decision to impose a lockdown is based on local health unit trends that continue to worsen after red zone control measures were implemented. Overall, the province and Ontario's Chief Medical Officer of Health considers these types of indicators to determine which zone or level Southwestern Public Health falls into. They look at the weekly case incidence rate or rate of new cases per 100,000 population, the percent positivity, the reproductive number, which is often noted as the RE or RT, which measures how many secondary cases are caused by one case. So a reproductive number of less than 1 means that the outbreak is decreasing because each case is transmitting the virus to less than 1 person. And a reproductive number over 1 means it is increasing because each case is transmitting the virus to more than 1 person, causing more spread. They also look at outbreaks, level of community transmission or non-epi-linked cases, hospital and ICU capacity, public health capacity to conduct case and contact follow-up. We can use these thresholds to inform when Southwestern Public Health may change into another level, but ultimately it is the province's decision. Over the past week, January 21st to 27th, there were 123 new cases reported to us. This number of new cases placed us in the red or high-risk level for weekly incidence rate. We were in the red high-risk level last week as well, but this week the incidence rate decreased, suggesting that public health measures are working to decrease the spread of COVID-19. We had 18 cases with unknown exposures, meaning that we aren't sure where they contracted COVID-19. This number of unknown cases is used to calculate the weekly incidence rate of non-epi-linked cases. We were also in the red high-risk category here. Among the cases where we did know their exposure, the exposures varied throughout the community and included things like institutional outbreaks, workplace transmissions, travel, and close contacts. Close contacts are defined as anyone you are 6 feet or less away from for more than 15 minutes, even if you are both wearing a face covering. Examples of close contacts are household members, friends, colleagues, or family members who visit your home. The range of exposures that we've seen support that we have community transmission in our region. Over the last week, January 17th to 23rd, 2.4% of people who were tested had positive results. A percent positivity of 2.5% or higher places us in the red high-risk category. Like the weekly incidence rate, the percent positivity also decreased from last week. We can see in this graph that among our active cases, or those that are still infectious, many contracted COVID-19 from an institutional outbreak, shown by the high number of residents in institutions and healthcare workers. Outside of our institutional outbreaks, Many active cases were in close contact with someone that was a case, like a household member or a friend, or had a workplace exposure. The exposure information helps tell us if our measures are working or not, and where measures are needed to limit transmission. The exposure data also demonstrates the importance of social distancing to reduce the spread of COVID-19. Over the last week, from January 17th to 23rd, 5,239 tests were conducted among Southwestern Public Health residents. Of these tests, 128 came back positive. That translates to a percent positivity of 2.4%. A high percent positivity means that there's more COVID-19 circulating in the community. As the percent positivity gets higher, we worry about cases going undetected in the community because not everyone may seek testing if they are exposed or develop symptoms. We can see in this figure that the number of tests conducted has been increasing over time since the start of the pandemic, but has recently started decreasing over the last 2 weeks. During most of the pandemic, our percent positivity was around 1 to 2%, but around the end of December, it increased to 6%. The increase in percent positivity corresponds with the increase in cases we've seen during that time. Over the last week, the percent positivity has decreased, which is promising and supports that public health measures have been working. Our epidemic curve shows when we've had cases in the Southwestern Public Health region over time. The dates used in this figure are based on when people were sick, what we call the accurate episode date, rather than when they were reported to us, because sometimes people do not get tested or do not get their results as soon as they become infectious. We can see in this figure that we've had a few surges, but most notably, the wave we are in now is the biggest. It looks like the number of cases over time are decreasing in this figure, but we cannot be sure until we see a steady decreasing trend. The most recent dates on the figure are preliminary, and more cases can be added over the coming days as we receive test results. To date, we've had 2,264 cases reported to us, and 187 remain active or infectious. Sadly, we've had 56 fatalities since the start of the pandemic.
At the beginning of the pandemic, around March and April, the average age of cases was higher, meaning that cases were on average older. Over time, the average age decreased. However, part of this decrease may be because testing was limited to those at higher risk at the beginning of the pandemic, which can affect the average age of cases. However, this graph does show that COVID-19 does not only affect older adults. It is important for people of all ages to take precautions and follow public health measures. When we look at our situation compared to our neighboring health units, we can see that in the past week, January 21st to 27th, we had the fourth lowest weekly incidence rate. Windsor, Essex, Niagara, and Chatham-Kent had particularly high weekly incidence rates. Although we were near the bottom for the weekly incidence rate, it is important to note that most neighboring health units, including Southwestern Public Health, had a high weekly incidence rate, above 40 per 100,000, based on the province's thresholds to determine public health measures. Elgin County and Haldimand Norfolk were the only two health units who were in the medium risk category. Cumulatively, since the beginning of the pandemic, we've had 1,070.5 cases per 100,000 population. Our cumulative rate is now higher than Brant County and Huron-Perth. We determine the neighboring health units' rates by using the data reported on their dashboards, which may differ from the provincial data. It is important to monitor the situation of neighboring health units as people can work outside of where they live, as well as they may shop or travel to locations outside of their health unit jurisdiction. Knowing the situation of the neighboring health units can also help to compare our region to others using rates, which takes into account population size to create a comparable unit, which allows us to see which areas have higher COVID spread and which areas have lower COVID spread. Professors from the University of Toronto developed models to forecast the number of new COVID-19 cases a health unit can expect to see locally over the next 30 days. We apply this locally to determine what our local forecast will be. Currently, the models are predicting that we will begin to see the curve flattening as 25 new cases will be reported each day into the end of February within the Southwestern Public Health region. At the same time, the models are predicting a decrease in new cases across the province, which is highly influenced by the Greater Toronto Area. It is important to recognize that these are just predictions and are not a guarantee that this will happen, but the projections do allow for us to prepare for what may happen. In the past, we have found that these projections have been fairly accurate. We currently have 5 Southwestern Public Health cases hospitalized, and of those 5 cases, 1 is in the ICU. We can see in this figure that to date, 41.9% of our cases that were hospitalized were admitted to the ICU. By looking at the top figure, we can also see that the number of hospitalized cases has increased over time, which corresponds with a recent increase in cases. Typically, when the number of cases increase, so too do hospitalizations and deaths. To date, 4.1% of our cases have been hospitalized. At Southwestern Public Health, we operate a call center. The call center responds to many different types of questions. Over the last week, from January 21st to 27th, we answered 409 calls. The most common reason for calling was because they had an exposure or were a contact of a positive case. We also had many questions about closures and reopenings, questions about COVID-19 vaccine, complaints, and people looking for test results. We use the call center information to help formulate communication messages based on trends for what people need information about. Typically, we get an increase in phone calls when things change across the province, like in September when kids went back to school. We also tend to get an increase in calls anytime the province makes a major shift in reopening, changing restriction levels, for example, from green to yellow, or when implementing a lockdown or a shutdown. A lot of the information that we shared today can be found on our COVID-19 dashboard. We have a few tips to help people use our dashboard. If you hover over graphs, a pop-up will give you some additional information. Filters can be used to help you find the information that is the most relevant for you. For example, filters change the view from active cases only to all cases. There is also a new filter on the epidemic curve tab, which allows for you to see where cases have occurred over time by municipality. The data on the dashboard can be used for awareness and personal decision-making to reduce risk. However, we caution that COVID-19 does not stop at municipal or county borders or inside the walls of a long-term care home. COVID-19 is active in our whole community, so although the rate of COVID-19 may be higher in some municipalities, it is important to use precautions everywhere. The numbers are only reflective of people who get tested, and many people work and live in different municipalities and health regions. Thank you.